subcondylar just means below the cartilage. So it's just in from the cartilage. I think you can see on the, so here you can see that it's like, here's the cartilage surface, so it's just below it. All right, so now we're talking about the plica, which is a residual embryonic part of the joint membrane that stays in place, and then it just is something for the knee to catch. So it's like something on the medial side of the knee here where they'll have problems, and it's just a residual embryonic piece of membrane that's still there that doesn't need to be there. So a lot of times, if it's enough of an issue, they'll just surgically go in and clip it. But what happens is that when the knee flexes, it just gets pinched on the medial side between the patella and the condyles of the knee. So repeatedly flexing it, it just gets pinched underneath here. So they'll be talking about pain on the medial side of the knee, right here. So if it gets irritated enough, it can get inflamed and swollen, so you can have a little bit of swelling, redness, tender to the touch, things like that. And then for the test, what we're doing is just forcing the kneecap medially and feeling under the underside edge of it here. So let's see. You're forcing the kneecap medially and then feeling underneath here, looking for areas of irritation and inflammation. So there might be some edema. You know, it might be one of those kinds of things where every once in a while their knee gets flared up, they got some swelling and tenderness on the medial side of the knee, then they rest it and it kind of calms down, and they do it again, it gets irritated and inflamed. So I'll play this video again. Basically all you're doing is you're just pushing the patellar medially and then palpating along the edge there. All right, so then bursitis, basically it's just something that you're visually going to be able to see. You can see the swelling on the knee. If it's the typical, the prepatellar bursitis is going to be swelling superficial to the kneecap, between the skin and the kneecap. And then depending on if it's other types of bursa, then you're going to see the swelling and inflammation, irritation in other areas. So it's either going to be acute trauma where they just bang it, or repetitive, you know, somebody's rubbing on the knee a lot, or like with running, you have the iliotibial bursitis where they're running and that iliotibial band is snapping constantly against the bone. So there's the iliotibial bursitis. It's going to be a specific spot on the lateral side of the knee where the iliotibial band snaps across it. So it's going to be repetitive motion, like cycling, running. A lot of times if they're doing something where they're changing their terrain, if all of a sudden they go off with a cross-country team and they're running up and down hills, things like that. So it's going to be, with any kind of bursitis, the tenderness is going to be right where that bursa is irritated. So the iliotibial band is going to be over here, different prepatellar and infrapatellar is going to be in this area here. And then we'll talk about it later. The Nobel compression test is basically where you're pressing over at that spot and you're doing like the terminal knee extension at about 30 degrees, and you're going to feel the irritation, or you're going to feel some popping when it goes over the bone. Now, with the patella tracking across the femoral condyles, you can get a range of different kneecap conditions. It's been called different things: chondromalacia of the patella, patellofemoral tracking disorder, things like that. It's basically wear and tear of the cartilage on the backside of the kneecap. Okay? And you remember, if you talked about in anatomy, you remember what the Q angle is? Okay. It has to do with the line between the femur and going through the patella, and then also coming up from the tibia through the patella. And then the more that this angle of the femur comes in at an angle like that, as the quadriceps contract, which direction is the patella going to get pushed? Medial or lateral?
Lateral.
This way here, because this muscle is contracting, it's going to force it over this way. Okay? So depending on the angle of the femur going into the knee, the greater that angle is, the more likely the patella is going to be shoved laterally. So one of the things they talk about for doing for that is to work on the vastus medialis, more specifically the VMO, or the vastus medialis obliquus, and that's done where you do exercise in terminal extension. So you're trying to work on this muscle to help pull the patella more medially to keep it from pressing out on the lateral side. And then, has anybody heard of that movie sign before? What's going to happen there is when they're sitting in the movies for a long time, you know, especially back in the days when they had double features, you know, you sit in the movie and then all of a sudden you go to get up, and it's, you know, you're going to feel that pain at the superficial part of the knee. So when you're talking about history and you're asking people about their knee pain, describe it, you want to say, you know, is it more superficial, like it's just under the kneecap, or is it more deep inside the knee? You know, sometimes more deep inside of the knee is more likely maybe to be a meniscus type of thing, versus if they say, well, you know, I can just feel it kind of popping right under the surface of the knee. When I sit for a long time, when I go to get up, I get all this popping in my knee. Because when you're extending your knee and you're in this position, the force is, as your quadriceps contract, the patella is getting more pushed right into the femoral condyles, right? Versus if you're extending here, it's more pulling it up. Whereas, so when you're getting up from this position here, that's going to be putting more pressure on your knee because your kneecap's getting pulled back into the femoral condyles. And then the other thing, let me go back for a second, is that a lot of times people, when they have knee problems, they tend to have problems more going upstairs or going downstairs. Downstairs. It's usually down, because they're putting more pressure down on the knee. But it can happen either way. But a lot of times with knee problems, the pain is worse going down. All right, so then there's just some basic things about this patellofemoral compression syndrome. It's pain, knee pain with either going upstairs or downstairs. You can have some acute trauma, or it can just be repetitive injuries. There's going to be pain. What you do is when you're palpating, and you can do this when the knee is an extension, you can push the patella to one side and sort of palpate on the back side, push it a little bit to the other side, try to feel on the back side of the patella and see where the pain is. And then this other test, which is Clark's test here, you're pressing down on the patella, forcing it down like this. And what you do is you ask the patient to contract their quadriceps like they're trying to pull their kneecap up. And if they have any kind of patellofemoral problems, they're going to feel that as pain, or it's going to be popping, snapping, things like that. So I'll try to click on this again. So you're pressing down on the kneecap and then asking them to contract this muscle here. Sometimes it takes a while to get the patient to understand what you're getting them to try to do. They're not trying to just extend their knee. They're trying to contract this muscle here to pull this up, and we'll practice that when we go around. All right, so then there's a few other conditions that you can go over that we're not really going to get into in this class a lot. But basically, you can have patellar dislocations, where the patella is forcing off to the side. Fat pad impingement, it's kind of like the Plica, where you can have the little fat pads that are in there that can get trapped into the knee joint. And then tendinitis. All right, so we'll take a break, and then we'll go practice the knee tests. I don't know.